Hi all, my name is Dr. Sharaf Sheikh Ali. I'm glad, first and foremost, to have my presentation accepted by this virtual conference. And I'm pleased to present our study by myself and two of my colleagues based at the University of Oxford on virtual reality and augmented reality in surgical education. Um, it's a narrative review, and we go on to describe some of the benefits of virtual and augmented reality in the future for surgical education. And any questions I'd like to take, hopefully during the live stream, and I'm looking forward to engaging with your presentations as well. So just to begin with, virtual and augmented reality has been, of course, used in surgery for a long time period. However, over, I would say, the last 5 to 10 years, there's been a sudden surge in new technological advancements that have allowed the use of VR and AR technology not only as a surgical tool to assist with operations, but also as an additive method to improve surgical education. And given this new expansion of material and technology and the new studies out there on this, we thought it would be wise to produce an updated review on VR and AR technology in surgical education, and mainly to focus on what we term these phase 2 technology advancements, which are mainly over the last 5 to 10 years or so, VR and AR technology. And we'll go on to sort of define phase 2 in a few more slides later on. Now, currently in the United Kingdom, the training pathway and so for the purpose of this review, we focus primarily on surgical training with respect to the acquisition of technical surgical skills. Papers published before 2009 were excluded primarily to focus as much as possible on the implementation of Phase 2 VR AR products, as hinted earlier. So this was a narrative review, and we looked at not only the academic literature, but also the grey literature, and I'll come on to that in a second. In regards to the academic literature, we searched two databases, PubMed and also Web of Science, and within those we identified 11 studies that looked at the effectiveness of VR, AR in surgical education, and we went on and further reviewed those in more detail. And as mentioned earlier, the grey literature, we realised, offered far more information and evidence and discussion than the academic literature could provide on current status of VR and AR technologies used in surgery and surgical education. So we thought it would be rather silly to avoid looking within the grey literature, which a lot of academic papers do avoid, for primarily the reason of evidence and the strength of conclusions based on the grey literature that are run by a number of different companies. But we thought it would be better and an additive to the study to have a look at the grey literature as well. And in order to do so, we adopted the approach to searching the grey literature described by Muhad et al., which essentially involves systematically searching resources where the grey literature is predominant, and that i.e. includes online databases and conference proceedings, for example, abstracts, web search engines, and the library catalogue as well. And additionally to that, we searched Google and Yahoo with the phrases virtual reality, augmented reality, and surgery, and that was done in April 2019. And we also included the first 50 pages of results from both sites. And you can imagine these would include company and industry abstracts and discussions and oral and poster presentations, media reports, and clinical trial registries as well. And we went on to analyze that further on. So as mentioned earlier, right at the beginning of our study, we tried to define phase 1 and phase 2 VR AR products. And simply put, we decided early on that early phase 1 VR products required external computing power sources and had limited graphics performance, which limited their use in surgery. However, the past 5 years or so, we've noted that there were this technological developments from smartphone industry, including high-resolution screens, mobile graphical processing units, and position sensing technologies. And these have all been incorporated into relatively low-cost VR, AR headsets, and these are so-called phase 2 products. As these devices have become more powerful and more widely accessible, the adoption of VR and AR technologies by surgeons and trainees has also increased. And examples of such use include hardware devices worn intraoperatively, applications on smartphones that stimulate surgical procedures, and then one off the top of my head is touch surgery that I can recall. Headsets worn to augment the in-theatre experience, and haptics to augment the sense of touch in surgical setting. And we named this group of VR/AR products as Phase 2. And from the slides, you can see how we sort of defined it. So this is just a quick flowchart to show how we obtained our 11 studies that we further analysed. And this leads us essentially to Table 1, which is essentially a summary of all the studies that we got from the academic literature. In total, there were 11 studies, and we sort of separated these out and looked at them and fitted them into this table where we highlighted the authors, the study type, the participants involved, the primary outcomes, and also their conclusions, study conclusions. And later on we look into the quality of each of these studies as well. And given the short period of time that I have to present this, I'm just going to quickly summarize that there were mainly 4 areas of skills or that were highlighted or acquired by use of the VR/AR platforms in each of these studies. And they were multitasking, time, so there's reduced time in performing a given procedure, accuracy in performing a procedure, perception of depth of field, hand-eye coordination, and speed of skill acquisition. Okay, I think that might have been 4 or 5 actually. And so this is just a continuation of Table 1. And similarly, these are a few more studies. In total, there were 11 studies. And I'd like to just highlight here that not only is surgical acquisition or surgical skill acquisition highlighted in these studies, and we do have another slide in the next table, Table 3, that highlights some of these skills acquired. But VR/AR also presents an ability to assess a surgeon's capability via objective measurements rather than subjective measures. And by that I mean it can be very difficult to assess surgical skills. And while current workplace-based assessments theoretically provide objective feedback and evidence that competencies for progression to the next stage of training have been achieved, they do have their limitations. However, the objectivity of the results can depend heavily on the assessor's interpretation and bias. Several studies have reported the beneficial and objective use of VR/AR as a tool for assessing surgical skills. And one of these studies was Lahanas et al., which you can see there. And that showed that a virtual reality box trainer can significantly distinguish between suturing skills of experienced and inexperienced surgeons, and that can be a very valid assessment tool. Table 3 here is just a summary of all the different skills acquired through the use of VR/AR products identified within the studies, and it's a table essentially just to summarize those skills, including multitasking, reduced time performing a procedure, perception of depth of field, hand-eye coordination by manual operation, and also speed of acquisition. These were the common skills identified throughout the studies that were improved by the use of VR and AR. Table 2 nicely leads us to a summary again of the different technologies used, including the different companies involved. And under the technology column, you can see that there are a number of different companies involved and different tech used, including the Oculus Rift, which is, as you know, a VR headset. There were different things such as laparoscopic box simulators, VR reality simulators, Lap Mentor, augmented reality laparoscopic simulator, and each varied in its application. However, as I mentioned before, the skills obtained from them were very similar. So just to summarize those results, the academic literature, there were 11 studies, and all of these studies involved the application of VR/AR in surgical education. Of those 11, 7 were randomized control trials, and the remaining studies were observational or prospective cohort studies. And there were some notable clear outcomes presented by some good RCT studies. So in summary, all studies showed a positive association between the use of VR/AR in surgical training and skill acquisition. These are just 4 points highlighted here in the slides, which you can read, that demonstrate what was obtained through the use of these gadgets. Table 4 is essentially a summary of the quality of each of the studies. It's quality analysis. We use the Newcastle TOA scale, and in summary, each of the studies did have a decent quality review, scoring quite highly in the majority of the studies. So, as we go into the discussion, the studies did review and demonstrate that VR/AR may be useful for increasing practical skills as well as surgical knowledge, at least in the short term. There are 6 large companies which have invested quite heavily in the application of VR/AR in healthcare. The market for VR/AR in healthcare is estimated to reach more than $6 billion by 2025. And in this review of the academic and grey literature, there was an overall positive association between improved surgical education and the use of VR or AR technology. Now, this is just a table that just highlights all the different companies that have actually invested quite heavily into VR/AR. And these were mainly taken out from the grey literature, and it was almost surprising how, or potentially unsurprising, how these vast, large companies have put a lot of money and a lot of wealth behind improving VR/AR for healthcare. And as you can probably guess, healthcare innovation is probably one of the areas that over the next couple of decades will take a turn, hopefully for the better. And there'll be numerous players who are trying to first and foremost get their foot through the door, as you say. And that includes Microsoft, that includes Samsung, that includes Facebook, that includes Sony, and that includes Google, as well as Apple. And again, you can see through this table some of the devices that these teams are using. So, to conclude, there is limited evidence currently available that suggests that VR/AR may have positive training benefits in improving the speed of acquisition of surgical skills, the ability of surgeons to multitask, the ability to perform a procedure accurately, to improve hand-eye coordination, and bimanual operation. So those are 2 good points: acquisition of surgical skills and assessment of surgical skills as well. However, there are quite a lot of variations in the study methodology, and the relative recency of wider VR/AR adoption in surgical training means that we can only draw tentative conclusions at this stage. And I think we'll go on to that in the next slide, which is sort of the limitations. So the reason I've written ethics is because the implications for data management, including ownership and confidentiality, where patients are included, as well as infrastructural requirements, should also be considered in the large-scale implementation of new data-heavy technologies. And it's really important, especially within the healthcare setting, that patient care and safety is at the forefront, and that's potentially one of the reasons why VR/AR is taking a long time to be adopted. And here I just highlight a few 3 bullet points on limitations of the review, and I do realize I'm quite short of time at this period, so I'll leave that there for a few seconds for you to read. These are my references, and I'd like to first and foremost say thank you very much for listening, and I will hopefully see you guys during the live stream.